Lung cancer starts when cells of the lung become abnormal and begin to grow out of control. As more cancer cells develop, they form into a tumor and spread to other areas of the body. Although most lung cancers do not cause any symptoms until they have spread, some people with early lung cancer do have symptoms including a cough that does not go away or gets worse, hoarseness, weight loss, appetite loss, shortness of breath, onset wheezing, or infections such as bronchitis and pneumonia that don't go away or keep coming back. If lung cancer spreads to distant organs, it may also cause bone pain, such as in the back or the hips, nervous system changes, such as headache, weakness or numbness of an arm or a leg, dizziness, balance problems, or seizures, yellowing of the skin and eyes, or lumps near the surface of the body due to the cancer spreading to the skin or the lymph nodes. 90% of lung cancers are a result of tobacco use. The risk of lung cancer increases with the number of cigarettes smoked and the time over which smoking has occurred. Among those who smoke 2 or more packs of cigarettes a day, 1 in 7 will die of lung cancer. Someone who smokes 1 pack of cigarettes per day has a risk of developing lung cancer that is 25 times higher than a non-smoker. And pipe and cigar smokers have a risk of lung cancer that is about 5 times that of a non-smoker. The 2 primary carcinogens in tobacco smoke that contribute to lung cancer are chemicals known as nitrosamines and polycyclic aromatic hydrocarbons. Smoking causes the majority of lung cancers, both in smokers and people exposed to secondhand smoke. But if it is not from smoke, it is most likely from exposure to radon gas, exposure to asbestos and carcinogens, or a family history of lung cancer. Lung cancer is the most common cause of death due to cancer in both men and women throughout the world. Statistics from the American Cancer Society estimated that in 2018, there will be about 244,000 new cases of lung cancer in the U.S. According to the U.S. National Cancer Institute, approximately 6.5% of men and women in the U.S. will be diagnosed with cancer of the lung in some point in their life. The cells that line the air passages of the lungs are the ones that are affected. There are 2 types, non-small cell and small cell lung cancer. Non-small cell lung cancer is the most common type of lung cancer, and within that, adenocarcinoma makes up 40%, squamous cell carcinoma about 25 to 30%, and large cell carcinoma 10 to 15% of non-small cell lung cancer. In addition to non-small cell and small cell, there are also lung carcinoid tumors, other lung tumors, or cancers that have spread to the lungs. Depending on the stage of the cancer and other factors, people who have non-small cell can take advantage of surgery, radiofrequency ablation, radiation therapy, chemotherapy, targeted therapies, or immunotherapy. For small cell lung cancer, depending on the stage and other factors, treatment options include chemotherapy, radiation therapy, or surgery. If you have small cell lung cancer, you will probably get chemotherapy if you are healthy enough. In both non-small cell and small cell, you may have many different types of doctors on your treatment team, including a thoracic surgeon, a doctor who treats diseases of the lung and chest with surgery, a radiation oncologist, a doctor who treats cancer with radiation therapy, a medical oncologist, or a doctor who treats cancer with medicines such as chemotherapy, targeted therapy, and immunotherapy, and a pulmonologist, a doctor who specializes in medical treatment of diseases of the lung. In addition, palliative treatments can also be used to help with symptoms. Sometimes more than one of these types of treatments are used.